I'm Michelle Leafloor, the Vice President of Health Information Technology Services and the CIO at Hamilton Health Sciences. I personally find it interesting that the notion that cloud computing is new is interesting, given it's been around and evolving for almost 20 years now. So somewhat speaks to the pace of technology adoption, particularly in healthcare, doesn't it? Healthcare IT adoption of cloud and all things, to be honest, has historically lagged other industries. And with respect to cloud itself, there's been some resistance and some long ingrained thought processes that have really driven that sort of lagging adoption. Fear of the unknown in clinical spaces, that drives all sorts of conversations. What does it mean? How is it going to impact? It's going to impact our patient care. That spills into the IT space, most certainly. Historically, cost and budget have been a perceived barrier for cloud adoption. Perceived, I will say. Traditionally, the majority of our IT investments were CapEx expenditures planned. We knew what our allocations were. It wasn't impacting the operating budgets. But with cloud, really came the move to an op expense. And this is a new challenge for healthcare budgets, particularly in the confined budget situation, at least in Canadian healthcare settings. However, that OpEx challenge is continuing because more and more products, as you are aware, are only operating in that space based on subscription and other solutions that are really driving a rethinking of how we budget our IT and digital health initiatives. Also earlier adoption in healthcare. Having done some assessments, some of the cost models were prohibitive at that time. There wasn't enough of a breadth of people moving to the cloud. So to be an early adopter really came at a cost margin that just wasn't practical. But we have seen that settle over time as cloud adoption increases, which provides us some opportunity. And third, the historical thing in healthcare that has really, and even continued ongoing discussions in my own team, is the concept of security, that somehow if things are in my data center and I can see it, feel it, touch it, that I can secure it more and better than in the cloud. Those are the historical things that we've had to overcome, and in some aspects continue to do. All that saying, though, I think a number of those historical concerns are hopefully in our rearview mirror, and we're being more forward thinking. And cloud is no longer really an option, but it's a question of how and where. So doing your proper due diligence. I think many organizations will probably see, including ours, a hybrid environment continue for a while, particularly while assets in our data centers are not yet fully depreciated. So when do you make that move? That takes a lot of lead time planning. And for some of our bigger assets that we would need to do refreshes in the next 3 years, we are doing the cloud assessment now, so that we're well ahead of that curve. And also some of this is really just not optional anymore. Many of our vendors in the healthcare space now only offer cloud solutions. So the reality is we're already addressing that. We already have a footprint in the cloud at Hamilton Health Science and a footprint in our data centers, a hybrid mode that we just need to continually to evolve and assess our options. Each refresh required in the data center, if we stay there, has to be assessed with, is this the right move to make? Do we stay in the data center, or do we have enough functionality and decrease risk to move to the cloud? Also, I'm sure that we'll talk about the topic of AI, but there are just some areas where we don't really have an option but to leverage cloud. Big computing, big analytics, AI, they are just beyond the ability of putting that stuff in a data center and being able to agilely scale up or down as needed. We don't have an option. And that's really where we're needing to go with the wealth of data and the potential to have big change on the healthcare organization, but also the healthcare system. To me, as I express it to my team, this is an opportunity. Don't see it as, oh my gosh, the cloud. The initial reaction of some of your teams can be, well, that will replace our jobs. I think it's actually that it will free them up to do value add work versus some of the more mundane things that come with running a data center. And so positioning it properly and working with your team so they understand the benefit and having them as part of the discussions around where this makes sense feasibly or not, functionality wise. It's complicated, the landscape. We all have multiple vendors, so keeping those really great vendor relationships with Citrix, with Epic, with Microsoft, with whomever are your big strategic partners, and understanding collectively how things are moving, so that you have partners at play in these decision making as well, is really important. Lots of work that we can do collectively together, but we have to be open to exploring these things and not just continuing that old model of I will always have a data center. It may be hybrid forever, hard to say, but it's changing rapidly.